Hello, I'm Dr. Howard Haft, Deputy Secretary for Public Health Services at the Maryland Department of Health and Mental Hygiene, and I'd like to thank you for watching this training video entitled Deceased Patient Protocol for High Consequence Pathogens. During the height of the Ebola outbreak in Guinea, Sierra Leone, and Liberia in 2014 and 2015, lots of people in the United States were frightened by the prospect of this disease becoming widespread in this country. Fortunately, due to strong infection control practices and public health response, this never happened. However, there were several patients with Ebola virus disease who received treatment in the United States, mostly healthcare providers infected overseas while caring for patients in inconceivably difficult circumstances. Despite the notoriously high mortality rate associated with Ebola virus disease, only 2 individuals with Ebola virus disease died in the United States. Often people don't want to think about worst-case scenarios, especially rare events, such as having a patient die from a dangerous infectious disease. The management of a deceased patient has not received a lot of attention in preparedness training. This video shows a practice method on managing a deceased patient with a highly infectious condition in a way that is both safe for the healthcare providers and respectful to the patient and family. We also know that training like this will help us all better be prepared for whatever other emerging infectious conditions we might encounter. Thank you for paying attention to this video. Your safety is important to us.
The following supplies will be needed for this protocol. Photograph the face of the deceased patient for identification purposes. Include identifying information such as name, date of birth, date of death, medical record number, and date and time of the photograph taken. Cover the head of the deceased using a small bag over the head and sealing at the neck with tape. This will minimize aerosolization of body fluid. The digital image must be sent out of the room electronically. The camera will need to be appropriately decontaminated or disposed of. Do not wash body or remove devices. Clamp or seal any lines. Collection bags should remain with the body to be contained in body bags. Perform hand hygiene. Wrap the deceased in a top sheet. Perform hand hygiene and change outer exam gloves if visibly contaminated. Place a hospital standard body bag under the deceased on the hospital bed and roll the deceased into the bag. Prior to closing the zipper, perform hand hygiene. Change outer gloves if visibly contaminated. Close the bag with the zipper, being sure to place the zipper at one end, not in the middle. Place a zip tie on the zipper to close the bag. Perform hand hygiene. Change outer gloves if visibly contaminated. Disinfect the outside of the bag with hospital-approved disinfectant wipes. Allow for drying and product-specific contact time for the disinfectant to work. Make sure to disinfect the bottom of the body bag. Perform hand hygiene. Remove outer exam gloves. Visually inspect PPE for contamination. Remove the top layer of isolation gown. Perform hand hygiene. Don a new pair of exam gloves. Move the pre-prepared gurney next to the patient bed. Remove the footboard and IV pole from the patient bed if necessary. Be sure to lock the gurney wheels. Position the hospital bed and the gurney to be the same height. Transfer the body into bag 2 on the gurney, taking care to avoid contact with the outside of bag number 2.
1, 2, 3.
Perform hand hygiene. Change outer gloves if visibly contaminated. Move patient bed 1 so that it is not in the healthcare worker space if possible. Perform hand hygiene after touching patient bed. Change the outer gloves if visibly contaminated. Close bag number 2. When closing the zipper, be sure to secure it at the opposite end from the zipper on bag number 1. Secure the zipper with a zip tie. Perform hand hygiene and change outer exam gloves if visibly contaminated. Disinfect second bag with hospital-approved disinfectant wipes and let dry. Perform hand hygiene and change outer exam gloves if visibly contaminated. Close bag and zip tie the zipper shut. Perform hand hygiene and change outer exam gloves if visibly contaminated. Disinfect the third bag and the gurney with hospital-approved disinfectant wipes and let dry. Be sure to wipe down any handles or exposed parts of the mattress. Make sure you disinfect the bottom of the body bag and the entire gurney. Perform hand hygiene. Remove outer exam gloves. Perform hand hygiene. Visually inspect PPE. Remove the remaining isolation gown. Perform hand hygiene. Don new pair of examination gloves. One healthcare worker will open the door into the doffing room using a disinfectant wipe. They will step into the doffing room and hold the door open for their coworkers. Walk through disinfectant-soaked pad before exiting room. The remaining healthcare workers will wheel the gurney into the doffing room up to the border with the cold zone. Roll gurney over disinfectant-soaked pad before exiting room. The body removal team will position the Reeves gurney or other mortuary gurney just outside the warm or hot zone and lock the gurney wheels. The anatomy board staff will transfer the body from the warm, hot zone gurney by sliding or lifting onto the gurney into the cold zone without crossing into the warm, hot zone. Use a backboard if needed. The hospital team and outside team will both help transfer the body onto the cold gurney. The body bag and gurney should already be clean and disinfected at this point. Healthcare workers on the hot side should perform hand hygiene and change outer gloves if visibly contaminated. The anatomy board staff will disinfect the third bag with hospital-approved disinfectant and then perform hand hygiene. Anatomy board staff will perform hand hygiene. Close the bag. Perform hand hygiene. Label the outside of the body bag for the anatomy board. The body on the anatomy board gurney can now leave the unit with the anatomy board staff.